Hi, everybody, and welcome to another ICA Sports and Fitness Science Council podcast as part of the ICA ChiroCast podcast platform. If you haven't seen one of these podcasts before, my name is Dr. Brant Hulsebus. I am on the board of the ICA Sports and Fitness Science Council, and I'm a chiropractor in Rockford, Illinois. And I am joined today by my good friend, Dr. Kyle Hoeft from, I always want to say Fishers, but I know it's Carmel, Indiana, right?
No, it used to be Carmel, but yes,
Okay.
now I'm back in Fishers,
Okay.
Fishers, Indiana, just north of Indianapolis. So, yep.
And Dr. Hoeft is also on the board with us as the ICA Sports and Fitness Science Council. And last podcast, we pulled up a research paper about ACLs, predicting ACL tears and non-contact injuries. And we got a lot of positive feedback from that podcast. So if you haven't listened to that one, go back and check it out. It's a really neat article about how chiropractic adjustments to the pelvis area and lower back could actually prevent, especially young females, having a non-contact ACL tear. What a cool way to integrate chiropractic in the sports world. And you know, in chiropractic, we're always prevention, prevention, prevention. Here's a cool way we can prevent things.
Absolutely.
So we went searching, we found some more articles to get good reviews on that. Today, we want to talk about another research paper, a physical performance affected by non-steroidal anti-inflammatory drug use. It's a systemic review and meta-analysis from the Physician and Sportsmedicine of June of 2024, volume 52, number 3, pages 207 to 216. And what this article does, it's for those of us who aren't full research nerds, which I know Dr. Hoeft and I were not in college, but we do a lot more today. They're taking a whole bunch of stuff, a whole bunch of research, a whole bunch of literature, putting it all together and trying to come up with an opinion based on everything they did. And this to me is interesting because, you know, I take care of the local hockey team, the Rockford Ice Hogs. I've taken care of basketball teams, baseball teams, soccer teams, MMA fighters, and even the local college I work with. And I know something about the athletic trainers because I kind of hang out in the corner of the trainer's room. I don't get too involved with their world. I just kind of hang out in there. And the one thing that I see gets popped like crazy are these non-steroidal anti-inflammatory drugs. The short word for that is NSAIDs, non-steroidal anti-inflammatory drugs. And I watch these players take them, and they're just popping them like candy. Dr. Hoeft, have you seen a lot of that yourself?
I see that a lot as well, and I imagine you see quite a bit more than I do, being right there with a lot of sports teams, the professional sports teams. Which is the most popular brand are you seeing that is over the counter? Are you seeing like Tylenol, Advil? That's what I typically see. A lot of Advil, a lot of the generic stuff too. But it's like you said, it's like they find that stuff. It's like candy, and they don't really even watch how many that they're taking.
The trainer for the hockey team has little packs all ready to go. To just come in and grab a packet. It probably has an Advil in there, an aspirin in there. They know that that's not my thing, so they don't really share too much of it with me. But I find that these players, they know they have a chronic lower back, they know they have a chronic knee, they know they have a chronic shoulder problem. So they're popping them before the game as prevention to try to prevent that pain. Then after the game, they're going in there for even more. And even the orthopedic doctors and stuff, I know that's I research these non-steroidal anti-inflammatory drugs, these NSAIDs a lot, and I know that's the first thing when you not even for athlete. If you have lower back pain or neck pain or headaches, and you go to your walk-in clinic, your primary, the first step is to give you a non-steroidal anti-inflammatory drug, an NSAID. Yep. And just even outside of this research, as I do read a lot of research papers, as a side note, chronic use of NSAIDs lead to chronic lower back pain and headaches. So I think it's ironic the pills that you're taking actually create the cause, could become the cause of what you're trying to prevent. But let's jump back to athletes, because an athlete's always worried about their performance and how they're going to compete today. You want to review a little bit of what we found out when we look at this article together about the use of NSAIDs and how it affects your athletic performance?
You know, it may not be surprising to some people, but for us, this is very important to bring to the average, to the average person, the average athlete, family. So these NSAIDs that that we've just talked about that are being prescribed every day, both before, during, and after competition. Number one, they did not improve physical performance. So some people may think that, oh, if I take this beforehand, maybe this will give me a little extra boost or a little extra, a little extra speed, a little extra bounce. No proof, nothing to show that. Number two, decreased muscle resistance performance. So that's another one there. If you're lifting weights and you're trying to build up muscle anabolically, those NSAIDs are not going to help you do that. Did not improve strength levels. Again, a lot of people in the weight room, a lot of people working with trainers and so forth, trying to optimize their strength levels and performance. NSAIDs aren't going to help you do that. What the bottom line is this: it's not going to help with your performance, and muscle strength gains actually decrease with regular use of NSAIDs. So, that's our tie-in with why chiropractic is so perfectly the best alternative to help get you those results you're looking for. Because we're going to work with the joints, we're going to work with that alignment, and we're going to get the pain reduced naturally and that mobility back to its normal level.
Yeah, I get up at 4:45 every morning, go to the gym, and I see some other people there with me popping these NSAIDs. And, after reading this, and I see that it actually is not good for you, it actually hinders your muscle growth and your repair and everything. It's just totally the wrong approach you want to do, especially like I said, I take care of a lot of minor league athletes and they're just trying to get to the next level. So that's kind of where we come in, right? Because people like, I still have my ankle pain. That's great. So I don't take this, right? I'm not going to take this, but I still have my ankle pain. I still have this lower back issue. I still have this knee issue. If you don't want me to take these, what am I supposed to do? And that's kind of where the ICA Sports and Fitness Science Council steps in. So talk a little bit about in your office. So I'm an athlete. I told you I've been popping NSAIDs every day. I've had this lower back pain. What happens if I walk into your clinic there in Fishers, Indiana? What should I expect?
So if I'm gonna have you come to my office and let's say, back pain, we deal with that every day. Let's talk about more detail. Like, let's say I got an athlete. Let's say I got a knee pain, a left knee pain on the inside of the knee of an athlete. That's a soccer player, for instance. Right away, we know that with that soccer player kicking a ball, the foot, and in particular, the bone called the talus, that is like the keystone bone of the foot. And that bone very commonly can get jammed up. And it does get very commonly jammed up playing soccer. So one of the first things I'm going to look for is to free up the mobility of that bone, because that releasing the normal mobility of that bone can also release the mobility of the knee, because now the ankle can dorsiflex or it can extend much easier, and that way that patient is getting the benefit of proper alignment, not just covering it up with a pain pill, or in this case NSAIDs. That I can't tell you how many patients I have helped resolve a knee pain just by adjusting their ankle and not even having to look at the knee. Just depends on the sport and their presentation. So that's just one example, Brant.
You can even take that, ask why is that one ankle going on, not the other ankle, and trace all the way back up to the L2, 3, and 4 area and get that adjusted. So I know when you come to my clinic, you get X-rays of your spine. We're going to examine your extremities. And we're going to see what motion isn't working right. So the bottom line is what we're trying to say in many, many words instead of a few words is we're going to find the cause. We're going to find out what's causing this issue, eliminate the issue, correct your biomechanics, and therefore the correct biomechanics being that we as calls chiropractors subluxation free, no nerve resistance, no nerve interference, then the body's going to perform the way it's supposed to. And actually, when we study with our colleague, our other board member, Dr. McDougall, they're actually lifting more. They're actually breaking PRs after getting their adjustments, which the science shows you can't do on the NSAID. Actually, it would just be the opposite. And that's
Absolutely.
that's part of seeing a sports chiropractor, correct? Because we have different, like I take care of athletes different than I take care of a grandmother, provided the grandma's not an athlete, right? Let's not cut
Yeah.
grandma short, but provided that we have a different approach. You want to talk a little bit about how we look at an athlete versus looking at an everyday person?
Yeah, so with an athlete, you're going to see they're probably going to be a lot more resilient. Their tissues are going to be stronger. Their bone density in general is going to be stronger as well because they're usually younger. So they can handle a few different techniques because of those generalities. Now let's take an older patient, maybe somebody that's around the retirement age, we'll say around 60, 65. Those patients are going to tend to have, they're going to be less mobile, more sedentary. So you're going to tend to see more osteoporosis, osteopenia type patients, and that alone alters the kind of technique that you want to use for those people. And their tissues aren't going to be as elastic because they're not as mobile. So the kind of adjusting and kind of treatment that you give them, you would modify it accordingly. And but that's a really good point.
I remember when you and I were at Palmer College, I used to get adjusted by Dr. Burns in his clinic, and he built a track around his clinic. So after you got adjusted, you had to do 2 or 3 laps around his clinic to help hold what he just did. And I think we can say that, as you were just mentioning, the person with osteoporosis, you used to live in Wisconsin. Around here, we call it the Milwaukee goiter, the big belly.
Yes,
That person, the odds of them getting up and going for a walk after an adjustment are a lot slimmer than your athlete. Your athlete just wants to
right.
say, "What more can I do? Send me on my way." So the patient compliance with the ideal chiropractic adjustment is so much higher with an athlete. So I found
Absolutely.
this article really neat, and I can't wait to share it with some of the strength coaches and athletic trainers I know. Just kind of get the word out. I probably even print it off and leave it on my front lobby there, where patients are waiting to come back to the room so they can read that. Any other suggestions you would do with this article? Who you'd share it with or expose it to?
I just think the drive home point here is that the NSAIDs are not going to help your performance. You might get some temporary pain relief, and maybe that helps you sleep at night occasionally or helps you get through your day, but it's definitely not something that you want to rely on regularly to treat any kind of exercise or sports driven injury. Your local chiropractor, they are the experts and they are going to be the most efficient provider to resolve those issues. Much better than the over the counter NSAIDs.
To that, whatever, as Dr. Kyle was talking earlier, the ankle is misaligned, there's problems in the foot, it's giving you the knee pain. That's a lot of stress to those ligaments in that foot. And if you just keep taking the NSAIDs and not feel it, your foot's not getting stronger, it's not getting better. So you have a choice. You can either go to the orthopedic doctor, get immobilized, either for the brace or surgery or something else, and go to a chiropractor and get mobilized and get back in the game. And that's kind of what we're here to teach other chiropractors.
Absolutely. Yep. That's exactly my thoughts on that as well.
Well, everyone, I want to say thanks for tuning in. Dr. Haith and I are going to keep going through some of these articles. And if you have a article you'd like to share with us, just go ahead and share it wherever you're watching or listening to this. And maybe you can even join us sometime and talk about a cool article you found on chiropractic. We have about another half dozen that we've got on deck, to use a baseball analogy. So, Dr. Haith, I want to say thanks for joining us.
Yep. Thanks for having me, Brant, and enjoy sharing the information that we learn. And this is stuff that's extremely relevant to today's athlete, especially multi-sport athletes that they get started early and early or younger and younger. So good stuff.
If you want to learn more about the council, I got a couple opportunities for you. One, just go to the ICA webpage, chiropractic.org. You'll find a link to us right there. You can reach out to us, meet us. If you're in Fishers, Indiana, or anywhere near Indianapolis, you can go up and meet Dr. Hafe. If you're anywhere in Rockford, Illinois, feel free to stop by and meet me and see our other board members wherever you are. We got them in Utah, we got them in Florida, we got them in Pennsylvania, Kentucky. So I'd love to meet you guys. Opportunity to actually meet us. We got coming up here in the end of July this year. We're going to be at the Pro Hockey Chiropractic Society in Minneapolis. So go on the Pro Hockey Chiropractic Society, see their website. That seminar is not just for hockey chiropractors. It's anybody that would like to work with athletes. In fact, if you go, they put you in a database, and then when a team's looking for a team chiropractor, you're in the database and they set you up. So if you want to do more of that, that's a great place to go. And I'll be there along with Dr. Curry from the ICA. Then coming up in Atlanta, Marietta Life University this fall at their big thing during September 18th weekend. If you're a chiropractor, you should know the significance of September 18th. Myself and then Dr. Kevin Jackson will be out there. We're going to have the stage on Saturday for a couple hours. Dr. Jackson's going to talk about subconcussive injuries. We got many articles about that, so make sure you find us there. And then we're hoping really quick here, keep your calendars open. July of 2027, the last weekend of July, we're going to have a huge announcement here about a symposium where you can come and meet all of us and learn from all of us and basically become a really confident sports chiropractor. And we look forward to meeting you. So in the meantime, like, subscribe, follow us, and feel free to shoot us any questions. So again, Dr. Kyle Hoeft, thank you for joining us. And
Thanks again, Brant.
we'll see you guys next time around.
See you later.